It's always great to hear that music on a Wednesday afternoon, and that means it's time for Helping Seniors of Brevard, the show for and about seniors, and you can hear it every Wednesday, 12 noon to 1 o'clock. Right now, let's get things underway as I introduce to you the host of Helping Seniors of Brevard and the executive director of the organization as well. Here's Kerry Fink.
Hey, John, good afternoon. It's always great to be here on the radio every Wednesday lunchtime as we gather around and we get to talk about good things on Helping Seniors Radio right here on 90.3 FM WEJF. If you're listening online at WEJF.net, welcome. And for the growing number of you that catch this as a podcast, wherever fine podcasts are available, whether it's Spotify, iHeartRadio, Apple iTunes, thank you for joining in today. On behalf of Joe Steckler, our president and founder, and our entire Helping Seniors team, we're so glad you're here, and we are so glad that we have in the studio with us our very special guest, longtime friend of the Helping Seniors. He actually volunteers his time also on the Helping Seniors Board of Directors. You know him because his face adorns the cover of magazines that every once in a while you'll see in the mailbox, or maybe you're at a grocery store. He is really, in my opinion, the area's preeminent authority on all things dental. We are speaking about I jokingly call him the father of dental implants because his practice was kind of founded on that. In the early days of dental implants, he really built up quite a following. And today, his experience is sought after literally across the country by dental offices and groups who are trying to improve what they do. And I'm speaking of none other than noted area periodontist Dr. Lee Sheldon. How are you this afternoon?
All right, Kerry, and how are you?
I am good. And then I'm in the office literally the other day, and they were telling me that you and several other dentists are working on a new process to help in this whole thing of deep cleaning. As anybody that's listened to any of the shows that we've done together with Dr. Sheldon know, he's really a champion of, it seems to me, this is Kerry's opinion, I may not be saying this correctly, a little bit less about filling that cavity and more about making sure that we've got really good mouth health going on as far as gums go and things like that. And literally the hygienist was talking to me about that you are participating with several dentists on this new process where you're able to put some fluid. I don't know. I'm going to butcher this terribly because I have no idea what I'm talking about, but they put some stuff literally in those areas where you may be having some pockets. And what she was explaining is that really is showing so great promise of being able to really allow things to kind of like clean out and then heal. Am I saying that right?
You're saying it right. You know, it's amazing. I take no credit for the research. I only take credit for applying the research and having some talented hygienists who can apply this. But this is a material, and I can't talk about it too much because we're still in the publishing stage, so I can't identify anything.
Right.
But I can say that it is something that's been around for 25 or 30 years.
Oh,
and
wow.
and some enterprising and very smart individuals who I'm fortunate enough to work with um, started experimenting and using this stuff in the laboratory to remove calculus. And calculus is a very, very difficult material to remove. I mean, it takes hours for us to do superb calculus removal, and it requires a lot of equipment. It requires a scope that goes down below the gum line so that we can do this without doing surgery. And all of a sudden, a chemical that's been around for 30 years is making that job, I don't know, 10 times easier. So it's very exciting, and it is applicable, and I'm about ready to at least let others know what this is, but I can't do it yet because they're in the process of going to publication first.
Well, I do know, Dr. Sheldon, that as we talk about this, one of the reasons that I wanted to bring that whole point up was the very fact that we've talked about so often that you kind of lead the way in terms of trying to always seek a better way for mouth health to happen, and so you're always kind of like on the forefront of that technology. One of the things that I wanted to mention about that was that I think you really have also gone out of your way to explain that mouth health has to do with everything a lot of times that's going on in the body. In fact, you wrote a book called The Ultimate Mouth Manual, I think is available there in your practice, or people can actually go to your website and maybe take it down. But it's just kind of like your commitment to excellence in that service area. And so, one of the things that we were going to try to talk about today, we were going back and forth saying, like, well, what kind of topic are we? We're here in getting close to the middle of June. It's hard to imagine that 2024 is just barreling along the way it is. And so we said, let's talk about a topic today. You need the full picture. And so with Dr. Sheldon of Solid Bite Dentalists that practice right there on Sarno Road, you probably pass a little billboard as you go to and from. But let's talk a little bit about a story that stimulated because it's actually an article that you've got coming out. We publish in the center of Senior Scene magazine each month, and we actually end up putting 12 pages in each center. We call them the yellow pages, and you can identify them because of the specific yellow border around them. But we're always trying to put information that helps you put together your aging plan. And so, Dr. Sheldon, this is a story that you've got coming out in the next edition of Senior Scene magazine called You Need the Full Picture. But what about the story got you thinking that this is something we should be talking about?
Well, everybody has what they need and what they want, and we've got to take that into account. I need to find out what you want before I can tell you what we can do or what we can or cannot do. But particularly when the person has already received another opinion someplace else, or the person has his or her own idea as to what's necessary. If I limited my examination to verifying that, in fact, we can do that, whatever that is, we miss the entire picture. Because that, whatever we're doing, this happened to be a dental implant, the patient had been told that he needed sinus surgery. He didn't. But what we also discovered was that adjacent teeth had severe periodontal disease, and the last thing you want to do is to put an implant in the presence of infection. And
Mm-hmm.
so it's the reason that I entitled this "You Need the Full Picture," and maybe it's more important, I need the full picture. Because when we're operating in the mouth, just because we're operating in one section of the mouth, and I don't care whether it's a cleaning, a filling, an implant, whatever it is, I need to know what that's touching on every side and make sure that there's stability that's present throughout. And if there isn't stability, I at least have to be able to predict for you whether, in fact, what you want is actually the right way of going. It may be a poor investment for you. So years ago, when I first got into practice, and you still see it, you see it almost routinely. A patient expects to make an appointment, seeing a patient for the first time, and we'll do an examination, a cleaning. And I never do that. I've never done that. I won't do that because my examination, a cleaning, doesn't really mean anything. If the patient has periodontal disease, a cleaning does absolutely nothing. If I don't have a chance of assessing the person's entire mouth to be able to at least give them an idea as to what needs to be done and what's going to be predictable in the future, then I don't feel I'm doing a good service for that patient. So every patient, originally we would have something called a limited exam. The patient would be referred for a particular procedure. I look at it, verify the procedure needs to be done, and then I look at the rest of the mouth, and I routinely say, well, what about this? What about this? What about this? And I would rather do the what about this and have you consider this before we start doing stuff in the mouth. So routinely, it's full examination, full examination, full examination, all the x-rays I need so that I can verify that that's all you need. Or that maybe that's not the best approach that we can take. Or maybe there's another approach that's less invasive that we could take based on the CT scan that we have and our dental implant design software. So that's where this "you need the full picture" came from. It came from patient experience last week, and I said, "All right, we got to talk about this. You need to know everything that's going on uh, in your mouth." And that isn't just in dentistry. Why do people go to the Mayo Clinic? Because they go to the Mayo Clinic because they want a full evaluation to understand how each part of your body is related to everything else and what the most effective treatment might be. If we start painting ourselves into a corner too early, then we may not get the entire picture.
Well, I was thinking about this. We've done television programs along the way because you called it the importance of a diagnosis. We've done talks where you've explained about how important everything is in terms of kind of like a holistic approach to. We're talking about typically when you and I are talking about specifically about dental and mouth health, but literally some of the principles that we talk about really have to do with general good practices for thinking about getting the best medical care. And so I was thinking about that, especially like we were talking about a little bit earlier in the show, that even though, your expertise and your practice is dentistry and very complex dentistry and periodontal treatment and things like that. But there's so much of it that you've also done a lot of research that the mouth really, as the mouth goes, so does your whole health go. And it really does seem like if you're going to be serious about trying to maximize everything that you can with your health and wellness, you're going to want to get like a complete picture. So you have how we always talk about that 35,000 foot overview. And then once you have sort of the lay of the land, you can then make those specific decisions that will help you navigate the actual terrain you have to traverse.
Yeah, it's so true, Kerry, because people with all good intentions say, "I need this," and of course, their knowledge is limited to what their knowledge is, what their wants are. My goal is certainly to be able to satisfy patients. Don't get me wrong, but my goal also is to make sure that they're doing the right thing. I'll give you an example of a patient that I just saw yesterday, and this was the second visit where I really needed to have really a comprehensive look at this and needed to spend some more time. But the patient was already, after having seen somebody else in another town or another state for some bone grafts, was ready to do dental implants. And I looked at it and I say, "This is not the best decision for you. Actually, we're better off doing this without dental implants. It'll be far better, far prettier, and 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 you won't have to have another bone graft with me." So all of a sudden he's ready to have a bunch of implants done, and I say, "No, regular crown and bridge work is going to be more effective. Your teeth are better implants than the implants are that we could put in." So yeah, I mean it goes in that direction. But you bring about overall healthcare, and it's not unusual for me to discuss diet with a patient before I ever get involved with the teeth. Or if the patient has pains, it's not unusual for me to talk about a chiropractor or physical therapist and where you might be able to get some relief for this particular problem here or there. I would much rather start with the overview and then go into the specifics rather than start with the specifics and miss what the overview is all about.
Yeah, even when we're going through that conversation, then I was thinking too that you really have the opportunity to ask a patient the things that you want to hear from the doctor's perspective. And I guess that puts the responsibility back on us as the patient to help you get like that full benefit of the complete exam so you know everything you need to consider or take into account to make those recommendations about steps that we ought to take. What do you need us to do as we come in the office and they say, because I remember that's always like one of the first questions, are you having any problems? Is anything bothering you? What are the things that you would want to hear us tell you that help you identify or help you get started on figuring out what's really going on?
The most important thing that I want to know is pain and infection, because those are the things that are health related. We've talked about this on the air before. There are the have-tos, and the have-tos are infection, periodontal disease, and tooth decay. And the want-tos are how do we decorate the teeth and decorate the mouth? And that isn't just decorating, we're putting teeth back into function. But it's certainly much more important from a health standpoint, and by the way, cheaper than anything else to treat the infections. So we've got to get to that. So I need to know what's been bothering you over the past couple of months is usually good enough. Tied to that, I do want a good medical history. People say, "Well, you're a dentist. You're just a dentist. What do you know what do you know my medical history for?" Well, we're injecting medications into your body. We are doing a certain treatment, and that treatment may be affected by the medications you're taking. So, yeah, I mean, we ask you to fill out a medical history. It's far easier now than it ever has been before because now you can do it online, and you just do check boxes and we get it rather than having to fill out the piece of paper. We still do the piece of paper for those people who want to do that as well. If I and then the next thing I do want to know is your diet, because if somebody is a chronic sugar eater, I need to know that, because if we're going to start crowning teeth or investing big dollars in teeth, we're really good at fixing them, but we can't prevent them from breaking down again, no matter how good our work is. And so I want to make sure that you're investing properly, and I don't want you to do work that's expensive that we're going to look at and is going to fail a few years later, without at least your knowing that. Um, a lot of this becomes part of the conversation that we have with the patient. And I'm so fortunate to have some very, very competent, well trained, and empathetic assistants who get to the meat, get to the heart of the matter before I even walk in. So they're spending 40 minutes with you before I ever get into the treatment room, and they know the questions to ask, and they know how to read the X-rays. They know how to do a lot of things. So between what's going to happen with the assistant and what's going to happen with me, and that's what's going to happen with the treatment coordinator for the next hour after that. Our examinations are 2 hours. Um, if you don't give it to us, we're going to get it. I get it out of you anyway. So,
Yeah.
and as long as we do it in a friendly manner and people understand that we're not doing it to penalize you, we're only doing it to get information so you're investing properly in your mouth, and it all works out very well.
It really seems so important because what ends up happening is, I guess it's kind of like this may be a silly analogy, but you walk into a dark room and you flip on a light switch and you got to illuminate kind of all corners of it so that you can really assess that situation. And so then, the patient comes in and says, well, here's what's going on. Just like the story you were telling about the gentleman who was thinking, and it's so funny because we've talked about this, you see an ad on TV and it just, we can, we'll get you set up with implants and you'll never have a headache in the rest of your life. And it's easy and call this 800 number and they'll get you all going. And it doesn't really, we've done whole shows where you've talked about from your background as a periodontist that you really understand that it's a good option in many cases, but it's not necessarily the only option or even the best option, just like you were describing. So when somebody comes in and says, this is what I want you to do, and maybe it's wrong. Maybe we just don't know better. Maybe we're influenced by something we saw on TV last night. And then you kind of got to educate us as we go through that process.
It's true, and actually, the commercials on TV have done a world of good for us and for dentistry, because people at least have some kind of a framework from which they can talk. After all, the full mouth dental implant restoration, which you see advertised all over the place now, has become a standard that people aspire to, whether they can afford it or not. At least they know it's out there. So that's helped a great deal. The difficulty that we've had with that approach, which becomes more of an education process, is that people still feel that dental implants are better than natural teeth, and in many cases they're not. So, I hear the stories. Oh, I did this, this, and this, and particularly when I see the periodontal disease stories. And my first question is, did you see a competent periodontist? Because maybe you could have saved those teeth. I can't tell you how many times over my career patients have come in and said, well, I'm told that I need all my teeth extracted, and they had their teeth through my entire career. So, and they had their teeth in comfort and function, not that they were running around with infections or anything like that. So, this we talk about the fact that this is very much a talent oriented profession. It is. I mean, every profession is a talent oriented profession, and take advantage of the talent of the individual you're seeing, because that person may very well be able to offer you a solution that's more predictable and cheaper than what you think is what you think is necessary. So the commercials are a double-edged sword, but I've got to say that the commercials are probably better for us than not, because once a patient comes in, they already have an idea as to what can be done, and then if we're good, we can communicate whether that's a good solution or whether there might be other solutions that might be better for the patient.
Yeah, well, even as you were talking about that, what occurs to me here is really the level of communication that's going on between us as the patient and the medical professional on the other side. In this case, we're talking specifically about the dental professional on the other side of it. But I was thinking, like, that's one of the things that I enjoy when I was, kind of like halfway teasing you about it when I see the magazine that has you and your son, Dr. Matt Sheldon, who's an excellent general dentist, cosmetic dentist, and Dr. Sheldon Furtado, who's a expert periodontist like yourself, and you guys are smiling in your lab coats on the front of that publication. But when you go into it, it's fascinating because there's so much different information. You don't just say, here's a dental implant, buy a dental implant. You actually take some time to go in and start explaining all the different things that might be possible, from simple cosmetics to great gum health and all those different kind of things that are in there. And it comes back to the kind of the takeaway for me as we're talking about this afternoon is that it really is important that you have that level of conversation back and forth, so you as the medical professional can hear what we as the patients are thinking about what we need, and then you can kind of educate and guide us down the track that's going to give us the most success in the long run.
It's true. And so, for example, Kerry, that's why I have implant design software in every examination room.
Oh, wow.
I want to be able to I can't tell you how many patients come in so we talk about the dental implant side, and many people don't need them. We've talked about that. Let's talk about the other side. I've been told I don't have enough bone for dental implants. And so we take a CT scan, which tells us the volume of bone that's present. I can isolate the place where an implant might be desirable, and I can put the implant in on a model of your mouth on the computer to see what would happen if we put the implant there before we ever do the surgery. And so, and in most cases, of course, there's enough bone for dental implants, or we can do a minor bone graft and create enough bone for dental implants. So
Wow.
that education process goes a little bit farther. I was with a patient yesterday, and I did that very thing. I had the patient CT scan. The patient had missing teeth. I started putting the implants in, and I actually put the crowns on the implants on the computer so people could see what the teeth might look like and how they would fit and all that kind of stuff. And it's a great education experience for the patient. But then I say, this is the old software. You want to see what we're using in the back in order to be able to do these
The
designs, because we're working directly with it's the two doctors plus the laboratory, and we're all designing things online together to
Yeah,
make
the
sure that
pace of
we're going to get the best
technology
result.
in this is incredible. Dr. Sheldon, we're going to continue our conversation on the other half of Helping Seniors Radio coming up next.
And you're listening to Helping Seniors of Brevard as we get back into the second half of the show. I'm John Harper. Right now, let's throw it back to your host of Helping Seniors of Brevard and the executive director of Helping Seniors of Brevard as well, none other than Kerry Fink.
Hey, thanks, John Harper. Always good to be here lunchtime on Wednesdays on 90.3 FM WEJF. And for those listening online at WEJF.net. And for those of you who are catching this as a podcast, thanks for continuing to listen in. And by the way, if you missed some of the conversation of the first half of the show, that's one of the reasons why we at Helping Seniors always make sure that we add everything to our fast growing library of senior information and resources. And you can access all of it, whether it be the TV shows, the radio shows, the publications that we're involved in. You can pick up almost any local newspaper or magazine and find a comment or two from our president and founder, Joe Steckler. You can also find the Helping Seniors news, which is found in the center section of Senior Scene magazine. There's usually 12 to 14,000 copies of that out every month, available at 500 plus pickup locations around the county. And then particularly, like, for example, if you are intrigued by the conversation we're having today with Dr. Lee Sheldon, noted area periodontist, and where the conversation is you need the full picture. And Lord knows we need the full picture on most everything if we're going to be successful at tackling all these different things. Then you can go back and review some of the earlier comments that we were talking about on this very topic. And so literally, welcome back to the show, Dr. Sheldon.
Well, thank you, Kerry. And what came to mind with you need the full picture. Here I am. I'm acting as a listener, and the listener's going to say, "Oh, you need the full picture so you can spend a lot of money, huh?" so I'm going to look at it in the sarcastic vein, and the answer is there are lots of times when I tell you you don't need what you think you need, and there are other times when we'll go through the full examination, and I say, "Boy, you're doing a great job. All you need is the cleaning." So understand, I've got to go through every step in order to be able to give you that assurance, and believe me, plenty of times we do give that assurance.
I was smiling actually as you were saying that, because literally the next question is, how do you determine what the best treatment is? And I'm thinking, like, well, if I'm sitting in the dentist chair, probably my answer to that question is, what's the least amount of money I got to spend? And then we're probably maybe incorrectly assuming that on the other side of the chair, they're going to tell us, well, here's the Cadillac version or something like that. And I realize it is a challenge because these things do cost real money. And I mean, particularly, you and I have talked about this. You actually do your, because we talked about this in the first half of the show, that you're insistent on doing a comprehensive dental exam. So even when people come in, you're willing to invest, upwards of $700 of the practice's money into a patient who's walking in the door, because you feel like, even though it's a loss leader, and we're going to talk about this great program that you have that benefits us as a charity called Solid Bite Gives Back, but you're willing to invest that amount of time and resources of the practice into a patient who's walking in the door, because you really want to have the information to give the best, the most appropriate table of options for somebody to look at.
Oh, it's true. I mean, we are a non-sales pitch organization. We just are, So I will give you the option from the full denture all the way up, if in fact you need that kind of major dentistry. I'm not going to just say, well, it's only implants and it's going to cost this. I will give the option. This is what this would cost. This is what this would cost. These are the things that we need to be able to do in order to be able to make the denture come out right. I can give you, here's a scenario where a patient says, well, can I just do the implants on the bottom but not on the top? And the answer is sometimes yes, but more often not. And the reason for that is whatever teeth we put on the implants on the lower have to mesh with what's on the upper. And if the upper is going to be replaced anyway someday, I would rather design the bite and have the tooth arrangement correct, so that when we put the teeth on the implants on the lower, even if it's against an upper denture and later on you're going to get dental implants, at least we have the design correct. So we're always looking from the tooth surface down to the bone, not from the bone up to the tooth surface. We want to make sure the bite is correct and the cosmetics are correct, whether we're doing it a step at a time for affordability's sake, or whether we're going to do it all at the same time. And we can do it all at the same time. There are plenty of people who come in on the implant side, and I don't talk very much about dental implants. I always talk about not dental implants. We'll talk about dental implants today. But there are plenty of times when patients will come in, we bring in the anesthesiologist, we take out all the teeth, put the implants in, and put the teeth, at least temporary teeth, on those implants all on the same day.
Yeah. Well, but isn't that going back to the whole premise why it's so important to kind of like take, I mean, I think about it anytime somebody builds a big building, they don't just go out there and go get some concrete blocks and just start stacking them. There's usually a design process that goes into the whole thing so they can anticipate. There's engineering to be done to make sure the building can stand those kind of stresses and all those kind of factors. And I'm thinking as you're talking about this, that's really the same challenge that you go through when you're talking about treatment plans and helping a patient kind of architect where they're going to wind up. They may have what the building needs to look like when it's all done, but then there may be some steps, but we got to take it in stages or with different things, and you probably have to factor all that into the treatment plan, right?
Yeah, absolutely right. I mean, everything is an engineering design that we're doing. It just happens to be in the mouth. And so,
Right.
yes, we have to measure the size of the foundation, and we have to determine what's going to fit in where and what's going to fit in properly between the cheeks and the tongue. It is quite a design process to get to where we want to go, where we need to go. But that's all worth it because once we've done the design, then we can fit the teeth into that design. If we don't do the design and we do things, haphazardly, where we do something here and then something there and something here and something there without an overall plan, then we can get into trouble. So I prefer to know where we are and how we're proceeding. Even if we're going to do this as a 5-year plan, I want to know that by the end of 5 years, we're going to say we designed this correctly. Even though we might not have gone as quickly as we could have, now that we're all done in 5 years, we've got things absolutely right.
That's really you've talked about this a lot, kind of like the predictability of treatment, because I guess nothing's more frustrating than to think, well, I've spent good money to get what I thought was my problem fixed, and then find out, I don't know, I'm making this up, 6 months or a year down the road that I seem to be having the same problem that I started out with. And I guess that's part, it's interesting because we were talking about in the first half of the show, the importance of communication between the medical professional and the patient and vice versa. But then also like setting those expectations. So we in the dental chair know, like, if I go this route, this is what I might be looking at a year or two down the road. But if I can go this route, it's maybe more sustainable. I don't know if I'm using the right words, but it seems important that we get that understanding when we're sitting in the dentist chair.
We should, and we can. And by the way, Kerry, and to look at it on the other side, there's sometimes when I'll see a patient, I'll say, these teeth aren't worth investing in. They just aren't.
Right.
But while you're chewing on them, at least you have these teeth to chew on, and that's better than chewing on a denture. So let's
Yeah.
invest no money in your teeth, as long as you don't have any infections, and keep things going for as long as possible. Now, part of that has to do with the patient's budget as well. But
Sure.
all of those things need to be considered. Yes, I mean I believe we do some of the fanciest dental work that you'll find any place. But that doesn't mean that we can't be realistic with a patient and say, all right, listen, I understand their budgets. Just let us know what the budget is, and I'll let you know whether it's worthwhile, whether it's not worthwhile. And that's very much on a predictability basis. We don't want to get in the middle of doing fancy dental work and only get a quarter of the way or halfway there and say, well, I can't afford it anymore. No, I'd prefer to know that in the beginning so that we're designing something that's within your budget. Just because we've got fancy crown and bridge work and dental implants doesn't mean that we can't still design the old way with dentures and partial dentures in order to be able to meet somebody's budgetary need. It's not what we do all the time. We don't, because people expect us. They see us for the fancy dental work because we have that reputation, but that doesn't mean that's all we do. I've got to, and Michelle, Dr. Furtado, and my son and Matthew, we're all thinking the same way, and that's why we have a doctor meeting every Tuesday at 4 o'clock to go over these cases and say, all right, the patient can do this, but can't do that. Let's talk about the different possibilities here so we can give the patient some options.
Yeah, well, really, and there's so much that you have to look at and consider from the medical side of this. What do you see as typically the things that are going to impact somebody's long-term success on this? Like, I'm imagining, thinking of that question, it probably has to do with, things like gum health and things like that. But I guess that's part of the skill that has to be involved is trying to look down the road. Like, if I do this, this is going to result in that, and those kind of questions.
Yeah, it's true. We'll cover the dental part first, and then go into the medical part. So the dental part is: are you willing to take care of your teeth? I don't care whether it's dental implants or natural teeth. Are you willing to
Uh-huh.
take care of your teeth? Well, I brush my teeth. Okay, well, you're not doing a very good job brushing. Are you willing to teach? Let us teach you and buy the equipment that needs to be done so that so we can make sure we can maximize the investment. If the patient says no, well, then I have an answer. If the patient says yes, then we have an answer. We schedule you with one of our dental education people to be able to get to the point where we can take care of things well, and particularly with the technology today. Kerry, do you know? Maybe you have the toothbrush. I don't know, but do you know there's a toothbrush that has an app that grades you on how you've brushed your teeth?
No, I got started with the powered brush, and then like a water pick kind of thing. I did not know that it doesn't surprise me, but I hadn't heard of that.
Yes, and it's graded me. So I've had the experience. But I remember a patient came back to us 6 or 8 months ago and said, "I learned how to brush my teeth on my phone by 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 this app grading my brushing." And yeah, it's the Oral B IQ. That's the brand name of the
Did you
brush. I'm
do
not getting paid by
so?
Oral
I'm
B.
just asking. I'm curious. Do you feel like it's helpful? Is it a good tool?
Yes, it is. It is.
Oh, wow.
Because I've used it in my own mouth. It lets me know on each part of my mouth where I've done well and where I've missed. So it's
Yeah.
actually grading me tooth by tooth.
I remember as a kid, they would give you these little, like they look like little either red or pink pills, and supposedly you would take those and then start brushing. And afterwards, if you were seeing the color, you're like, oh, you missed spots.
That's right. That's plaque disclosing tablets. Yes.
Yeah, well, we've come a long way, baby, as they say. All right, so here's a question that's kind of related to this whole conversation. And how does somebody? I guess this is probably a consideration too. How does somebody's overall health fit into when you're talking to somebody about, like here's some ideas of what might be the next thing to do. As we're talking about your mouth.
Yeah, I mean, if we're talking about overall health, we look at things like osteoporosis and the medications you might be taking for that, because some osteoporosis medications, in fact, most of them, will interfere with bone healing if you've taken them for a long enough period of time. And so there has to be a withdrawal period from these medications in order to be able to do the surgical procedures that we need to do um, in order to limit the rare possibility of an oral infection as a result of doing a procedure under the influence of these medications. The other things are have to do with overall health, heart disease, things like that. Most of which is well under control. But I will routinely send a letter to the cardiologist, getting guidance from the cardiologist to what the person can and cannot do. The cardiologists all know who we are, and of course we've been doing this work for a long time, so they'll be able to give us good guidance. But most often, it's we do the routine things that we need to do. We have a medical anesthesiologist who comes in on a regular basis, and and the patient's cardiac history is very much going to influence how the anesthesiologist is going to act. And so we want the EKG, any EKG that's been done in the past few months, and then we'll be running an EKG during our surgical procedure as well, in order to be able to make sure that you're treated well and you're treated safely. Diabetes is important. You know, if your blood sugar is not under control, then your opportunity for infections is much higher. And most often, blood sugar can be brought under control. That's a matter of your dietary habits at home, being under having the right medication. There are times when we will refer you to an endocrinologist who is the specialist in diabetes control in order to be able to make sure that happens. So those are the basic things that we look at. We do a complete medical history because other things are going to come up, and sometimes there are medications which will influence the medications that we can prescribe, and we need to have that in advance, and that's why the comprehensive medical history is so important. But it's routine that Matthew and Michelle or I will be writing letters to your physicians to make sure that everything's okay, and almost always it is, and we can proceed.
So important as we're having this conversation about all these different factors, which is why it's important. We titled this show, You Need the Full Picture. And it's funny because it has to do with you as the person who's trying to figure out the best thing for your own mouth and your own medical care, but also so important for the for the medical professional, the dentist or the doctor that's trying to make a difference for you there. And that's why, Dr. Sheldon, I kind of wanted to reserve a minute. I'm going to have us talk a little bit about some of the events and things that are coming up on the Helping Seniors. Want to give everybody a minute to grab a pencil so they can jot down some important dates coming up. But before we get there, I wanted you to share, we talked about it just briefly, that you have a program that really does facilitate that communication link between a patient and your office, and you call it Solid Bite Gives Back because it's basically that comprehensive dental exam, but then it helps us in the work of helping seniors. So it's like a win-win-win. You as the medical provider, you get the information and the full opportunity to really get every piece of information you need to set up a good overview. And then for the patient, they're getting a tremendous deal because it's a $700+ kind of comprehensive examination. And then for helping seniors, we benefit because it supports the work of helping seniors.
Yeah, it's true. So all you have to do is call the office 321-259-8000 and just tell them you've heard us on the radio today. And any staff member will enter you into Solid Bite Gives Back program. Essentially what that means is that on the day of the examination, bring a check with you, write that check to Helping Seniors of Brevard for $50 or more, and you'll get the entire examination, all the extras, CT scan, all at no charge.
Wow. So we're talking with Dr. Lee Sheldon, who's noted area periodontist with Solid Bite Dental, Doctors Sheldon and Furtado right there on Sarner Road. I guarantee you've seen the sign as you go up and down that road. And you guys have really been friends of helping the work of helping seniors for all these years. And speaking of helping the work of helping seniors, I want to take a moment to give you a couple of dates because we are now entering the car raffle high season. We are here and we are in June, and we are already on the countdown now to the 8th annual Helping Seniors car raffle grand drawing. And this year we called it Choose Your Adventure because there's so many great cars to select from in the car raffle this year, Dr. Sheldon. Because all these cars, as you know, come from AJ Hires family of Boniface Hires car dealerships. And so there's everything now from a Jeep to a Chevrolet Colorado pickup truck to a Mazda 3 sedan. I mean, the list of cars goes on. It's an incredible. There's a sporty Dodge Hornet in there. A couple of great mini SUVs from Kia, the Sportage, and from Mitsubishi, the Outlander. And somebody's going to pick their new driving adventure on Sunday, October 27th at the American Muscle Car Museum. So we have a couple of events that are coming up. We as we get closer in, we always show up at all the great car events, and people love to come. Our team gets out there. We have the tickets available for you on site. So you could go by, for example, tomorrow night, Thursday, at Friendly's. It's a great show, beachside, put on that they have cars, trucks, bikes. It's a fun afternoon in the evening from 5 to 8. Our team is going to be out there on Saturday. We're going to be out beachside in Indy Atlantic at the Dunkin' Donuts car show. That runs from 8 to noon at the Dunkin' Donuts right there in Indy Atlantic. And then we've got all kinds of things coming up. Another date that I'd like for you to be thinking about is our Taste of Adventure date that's coming up on July 27th. So you have to get that one on your calendar. It's a Saturday afternoon sip and stroll, 7. It goes from 2 p.m. to 5 p.m. We're actually holding it there at Joe's Senior Resource Center of Brevard. And it's Chef Jillian, who is a wonderful, wonderful chef. She owns a company called Chefs for Seniors, and her team of chefs are cooking up some really great food tastings, and it's a little fundraiser for us. It happens on that Saturday, the 27th of July. So you got a little bit of time, but let's put it on the calendar. And it's it's going to be a wonderful afternoon. Everybody who comes out actually gets to come home with their very own personal chef's apron to kind of commemorate the issue. And the apron says cleverly enough, I am helping seniors. So remind you of the cause. It's a great cause. How do you get information on this? You can go give us a call at 321-473-7770. It's 321-473-7770. If you talk to Nancy or Kerry and say, hey, I heard him talking about food and I want in, we're jokingly calling it Eat at Joe's because it's not a diner, but Joe's Senior Resource Center of Brevard, that beautiful spot right there at 1344 South Apollo Boulevard on the second floor of the Omni Healthcare. That's where we're going to be. So what a great opportunity that's going to be. So call us at 321-473-7770 for tickets for that. Or you can just go to helpingseniors.org and you'll find information there. And you can also find information about how you can access your car raffle tickets there as well. And so with that, Dr. Sheldon, I wanted to ask you, I think you've got tickets over at your office, and
Yes,
you're a
we
pickup
do.
place, so people can come get the tickets there at Dr. Sheldon's office. Have you figured out a car that you like in this particular choose your adventure world? Again, there's so many neat ones to choose from.
Yeah, I'm very much thinking about a sports car, but I know as soon as I got it, I'd say, "Why did I do this?" So I'm probably more of, "Is there enough room for the car seat for the grandkids?" So that's my mode right now.
It's so funny. We've joked about this for quite some time because our little team, Jennifer Barton, who is on our board of directors, she's the owner of Seniors Helping Seniors. For many years, it's just been this story, even though there's been other cars in the race, it's been Dodge versus Chevy because Jennifer has been a big proponent of the Dodge Challenger, and Ashley Caswell, who's on our board also, she pretty much staked out Camaro territory. Well, both of those cars don't exist anymore as terms of new models. You can probably still find a great classic model, but it was not an option this year. And so we thought, well, this is going to be different when we try to do choose your adventure. But what we're learning, Dr. Sheldon, if we go back and look at the history of the cars that the winners actually picked, last year, our winner, Diane Pelak, said, I want the Mitsubishi Outlander. And I think not the year before, but the year before that, our winner there, a guy named David Odahowski, he wanted the Kia Sportage. So going back through, this is the 8th annual Helping Seniors Car Raffle. Yes, we've given away a couple of Camaros, and yes, we've also given away a Dodge Challenger, but we've actually given away several SUVs. And I was thinking, just to your point, is probably the fun of it would have you look at the sporty car, and there's a Dodge Hornet in there if you want a kind of a little street racing rod. But I think a lot of people say, like, I like the idea of one of the SUVs as well. And that's the fun of it. When you buy the ticket, you're supporting the work of Helping Seniors of Brevard. And that is so important because we can't do the work. As a nonprofit, we will only be able to help as far as you allow us to help. And by help, we got to have your financial support. It's a fun way to do it. One ticket is $25, 5 tickets is a $100 donation. And each ticket gives you a great support of Helping Seniors, gives you a great shot at winning a car, and then a fun Sunday afternoon out at Mark Pylock's amazing American Muscle Car Museum. And they're putting together some stuff that's going to be a lot of fun. We're going to make this a family-friendly event Sunday afternoon at the museum, and it's just going to be a great time. So I would say, Dr. Sheldon, if you win a car, you're going to have a really great Sunday. But even if you're just out there to enjoy the fun, it's going to be worth the time to get out to the Muscle Car Museum and see everything that Mark has in there. And he keeps adding cars, as you know, Dr. Sheldon.
Yeah, he does, and Mark. I mean, Mark does everything. He provides the refreshments. He provides the facility. He provides the volunteers. He provides everything for us and many other charitable organizations as well. But if for anybody who said, "Well, the event was so crowded last year, I couldn't get in," we've remedied that problem too. So it'll be a great day
Yeah,
for
that's
all
why
of
we're
us.
spilling out inside and outside this year.
That's
That's why we
right.
moved it to the afternoon. It's going to be great. Thanks, Dr. Sheldon, and thank you,
All
listener,
right.
for joining us. We'll see you next time on Helping Seniors Radio. See you next Wednesday.